And in terms of conflict, obviously conflict between partners, I mean, they say money, I think, is one of the commonest things that causes conflict in relationships, and disagreement on parenting, I think, is another really big conflict. What are the commonest themes that you see in your practice with regards to conflict?
Definitely communication. Communication from a place of not understanding yourself well. I like to say to people to try to understand how are you starting up the conversation? Do you think your partner has a green brain or a red brain right now? What tone of voice have you used? How did you ask the question? Right? And always coming from a relational point of view. We're very linear when we talk and when we approach problems with our partners, So the relational approach is something that I'm very pro.
So what does that mean?
So thinking relationally, not linearly. So if I'm asking you, so for example, if I say to you, every time I want to talk to you, you shut down. It's very frustrating. Can't deal with this anymore. It's a very linear way of thinking. I'm not thinking relationally. I'm not thinking how that's going to impact on me and us. So a better way of saying that would be, I know it's hard to talk about difficult stuff. I know perhaps that sometimes you shut down because you want to stop a fight. But it's very important that we can address things that are happening right now. When do you think is a good time to talk? Or is it a good time to talk? You see the difference?
Yes.
Yeah. So the communication from that relational perspective, but also understanding my own triggers, my own issues that I'm bringing perhaps into this relationship. So that's where communication breaks down. The attachment is ruptured, and then there is the conflict. If I don't feel connected, if I don't feel safe, that's a rupture. That's where the communication gets. So understanding that from the self, I think is important. Parenting is a big one. Parenting differences, is a big one. I think the other thing that we're seeing a lot, unfortunately, that we didn't see in the past was the rise in mental health issues in children these days. I mean, I believe that in Australia, the leading cause of death for the youth is suicide. And it's, to deal with children, it's working, raising children, looking after a house, looking after yourself. There's a lot there. There's no help, Most people here in Australia have parents all over the world, or grandparents are not around as, we used to have in the past. And on top of that, you have a child with a mental health issue, which is very common, unfortunately.
Yeah, absolutely. I have definitely a lot of families and relationships under a lot of pressure because they have children with a lot of health problems, maybe quite severe autism or behavioral problems or school refusal and things. And the strain on the family is immense, and it can be really challenging for those relationships. I think we can get a little bit blamey of our partner in those situations.
Yes, and that's one of the skills of the healthy adult, that when we process our unresolved issues, and we look into our triggers and we understand where we're coming from, the blaming and the criticism tends to drop, right? So doing that personal work, I think, is extremely important, right? And sometimes, the conflict over parenting will be a reason for coming and seeing someone like myself, and yes, I can give you parenting strategies and talk about behavioral things, or see a child psychologist who will give you, a list of things that you could try and this and that. But behind that child's behavior and mental health issue, there's a couple with their own set of issues and their own dilemmas that they need to deal with. So doing that work themselves, I think it's essential. All right. So looking for help, well, we want to target this in a united way. we want to come together when we come to this child or when you come to a professional. We want to have join forces instead of you end up seeing sometimes that people are against each other, and they're causing another problem on top of what they have already. So it's a lot of that self-awareness work that helps with parenting, I believe.
Yeah, absolutely. And not being in competition with the other parent to be the favorite parent. I've had a couple of male patients who've been reluctant to see a female relationship therapist. They've or female patients who said their husband will only see a male therapist because they feel like if they see a female, they're going to just be on the woman's side. Yes. Do you come across that where initially you sort of feel like you have to nearly win the man round to say that you're going to be fair, or?
Yeah, we definitely see that. There is a belief, I guess, that we're going to gang up against them as two females going at them. And I get that. So I like to see people always together. Like, for example, this person that came and asking what to do, and I said, look, if you want to continue seeing me for relationship counseling, I'd like to see your husband on his own before I see you again. Because I like to be very fair, and I want males to feel that they can have the same treatment and the same fairness, and the same respect and care that the female is having in the room.
And do you think that the barriers around relationship counselling and therapy are lowering? Do you think people are more open to it, or do you think that there's still a stigma attached to seeking support?
I believe it's decreasing. We can still see a stigma attached to it, but I believe it's decreasing. People are more and more open to do the work. I think with everything else, if you see all these other ways of looking after yourself and growing, I think it's a sign of growth. People are seeing as a sign of growth, not as like a repairing, kind of place that you go and you dumped there for some serious work because there's something very bad going on with you. It's more like a healing space in which you can grow and you can develop skills that you don't have. Relationship skills is not something that we learn. Tell me, where do we learn relationship skills? We learn by what we see, perhaps, with our parents. And then if it was a bad one...
Yes, the modelling hasn't been very good.
Yeah, well, if it's a good one, then yes, it was good for them, but is it good for you and your partner? So the relational skills, so that's something that we teach a lot.
When I started this podcast back in December 23, I knew that I was lucky enough to have amazing conversations with various health professionals across all facets of medicine and allied health. And I knew that you would probably really enjoy being a fly on the wall to hear what we talked about. And that's how the podcast was born. And what you probably don't know is that this is a bit of a passion project. We don't have any sponsors or funding. And without your help, we won't be able to continue bringing you these great guests. So if you can please spread the word about the podcast, share it with someone who you think might benefit from the conversation that you've just listened to, or if you can leave us a review or a comment, it would mean the absolute world, because that actually helps the podcast spread further and get more people to hear our message and hopefully allow us to invite bigger and bigger guests onto the show. And I would so appreciate you helping me back. Thank you. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.